Aldrin Sampier on Beyond the Headline.
I meant to say that the Board of Healthcare Funders had nominated Morgan Chetty, the president of the Independent Practitioners Association and also member of the Service Delivery Committee for Vaccines, to join the debate. They have now pulled out, but as a team, we've decided to continue the conversation and unpack the letter that had been sent to the president of the country by Dr. Herman Edeling, alongside 7 other healthcare professionals. And Dr. Herman Edeling now joining us on the line. Dr. Edeling, good afternoon. Thank you so much for making time for us. Apologies for what has transpired, but thank you so much for agreeing to continue with the conversation with us.
Thank you very much, Aldrin, and nice to meet you. I was looking forward to having a debate, but in the absence of a person to debate with, I'm very happy to be interviewed on this subject.
Okay. When you and the 7 other healthcare professionals decided to write this letter to the president, what prompted it?
Well, I have to talk for myself, Aldrin.
Sure.
What prompted me in initiating and writing this letter was my Hippocratic oath that I took when I was graduated as a doctor. And in that oath, I took an oath to treat my patients in their best interests, to do them no harm, and to respect their human dignity, in essence. And I came more and more to the realization that things were happening and things were being done which were harmful to the health of the people of South Africa. And that is why, because I understood that these things were harmful, I considered it my ethical duty to state that in a public manner. I sincerely hoped that the president would understand the seriousness of this, and that the president would respond to our very serious concerns and our serious and reasonable requests. So far, the president's office has acknowledged receipt of our communications, but we've not had any meaningful response from the president or from anybody authorized by him to respond.
Okay, so that means that even as it stands currently, from your summation and looking how things are, would you say that the status quo remains, and what you've articulated in that letter?
Yes, this letter was written on the 10th of August, and it was submitted to the president on the 10th of August. Since that time, I have not seen any of the things changing which we refer to in the letter.
Mm-hmm. Okay, let's deal with some of those issues. And there are a number of issues that you've highlighted in that letter. One of the first ones that you speak of, and just quickly to unpack this, when you say that the messaging or the narrative is harmful, and it is informed by something that is irrational and also misleading, what do you mean by that?
All right. Well, Aldrin, if I can refer to the paragraphs in the letter, the first paragraphs deal with background and context. And then at paragraph 1.7, I identify 8 elements of the official narrative with which I take issue. They are in paragraphs 171 to 178. And I think everybody will agree with me that all 8 of those very briefly identified issues are part of the narrative that is put out by the Department of Health and by the president, and which is amplified by the media. Now, I will go one by one and tell you why I have come to the conclusion that each one of those is harmful, and it's harmful either because it's false, or because it's misleading, and or because it's irrational. So if I can give you an example, the first element I note in paragraph 171 is that the PCR test in current use identifies persons who are infected with SARS-CoV-2. Would you agree, Aldrin, that that is part of the official narrative?
Sure.
Okay, now if we go to paragraph 1.8.1, I state that the coronavirus PCR test is non-specific and yields false positive results, as it has no capacity to differentiate between SARS-CoV-2 and a variety of viruses that cause flu or the common cold. This has finally been acknowledged by the CDC, that's the Center for Disease Control in the USA, who have declared that PCR testing will be withdrawn in December 2021. Now, seeing that that is the truth, it means that when you have a positive PCR test, you're not sure whether you have SARS-CoV-2 or not, because your test result may be a true positive and it may be a false positive. And when we hear, for example, figures given out by the Department of Health, 10,342 people have been diagnosed with COVID-19 in the past 24 hours. We don't know what percentage of that number actually have SARS-CoV-2 or COVID-19, and what number of people have something else.
Mm-hmm. So what is it about the PCR test that cannot detect that?
Well, Adrian, the PCR test detects genetic sequences. Now, the SARS-CoV-2, scientists have determined the genetic sequence of the spike protein. And so the PCR test is supposed to detect genes in that sequence. But there are other viruses that share certain commonalities of gene sequence, not the identical sequence from beginning to end, but certain portions of them are the same as in SARS-CoV-2. The PCR test can't differentiate between that. Now, in particular, if the test, because there are minute quantities of genetic material in each test specimen, the test is run through what is called cycles to amplify the amount of genetic material so that it can be tested. Now, if, for example, the test is set by the manufacturers to be run at 25 cycles or 26 cycles of amplification, and then if it is tested at that number of cycles, it will give you a more accurate reflection of how many really are SARS-CoV-2. But we know that the laboratories run the test for many more than that, to 30 cycles or 35 cycles or 40 cycles. Mm-hmm. And with so many cycles, by amplifying so much, it picks up genetic sequences that are from other viruses and not SARS-CoV-2. Now, what we don't know, and I don't know if anybody does know, what proportion of positive results that are obtained are true positives and what proportion are false positives.
So then does it follow that, sorry, Prof, we have to push through this as well, because there's a lot that we need to deal with through this letter, that's in the letter as well. So then does it follow that based on what the CDC, based on that alert that was sent by the CDC to labs, does this then mean that the COVID-19 positive cases have been grossly overstated?
Well, I can't say grossly because I don't know what the proportion of false positives is. Mm-hmm. So if the proportion of false positives was 1%, then it would be overstated, but not grossly overstated. If the proportion of false positives is 30 or 40 or 50%, it would be grossly overstated. Mm-hmm. So one of our big problems, and this is a thread that runs through the whole letter, is that important information, important facts that are necessary for scientists, doctors, and members of the public are being kept secret by the authorities. They are not disclosing the information that we are entitled to have for our own health.
Is there a way to detect and bring in that distinguishing factors?
That's what I'm asking the president. I'm asking the president to obtain from the suppliers, from the people who have authorized and approved these tests, to provide us the information of what the false positive rate is. I can't say it. I don't know. And when information is being hidden away, Aldrin, how can anybody know whether it's available? Mm-hmm. But surely the manufacturer who provides the test, the SAHPRA that approves the use of the test, the South African Health Department that publishes daily statistics based on that test, surely they have a duty to the public to ensure that the test is accurate. And if it is not accurate, to tell the public to what degree it is inaccurate. Mm-hmm. Surely.
Okay, then there is the issue around you speak about there's good evidence for safe and effective medical methods of preventing
Yes.
COVID-19. Are you here speaking about preventing COVID-19, or is it treating patients who have COVID-19? Because in the letter, it almost looks as if you're speaking about the treatment of patients who have tested positive COVID-19.
I'm talking about both, Aldrin. You'll see in paragraph 183, I say safe and effective methods of preventing COVID-19. And the next paragraph, 184, safe and effective methods for early treatment.
Mm-hmm.
Now, all of those are summarized in a very easy to read document, which I call the good news document. That was a document I compiled earlier before I sent this letter. And that document is based on 24 references. So there are 24 source documents from investigators, doctors, scientists around the world. I got information, and the information obtained from those sources is summarized in my good news document.
Mm-hmm.
It sets out very clearly what methods to prevent COVID and what methods to do the early treatment of COVID. It also provides the principles of treatment in the secondary or inflammothrombotic phase of COVID.
Okay.
And all details about that can be read in the source documents, which are available through that document as active links.
So speak to us quickly about methods to prevent COVID-19, because now we're dealing with a situation where we're trying to find vaccines for COVID-19.
Yes. So first of all, we talk about what is called nutraceuticals. That means normal nutritional components of good food, such as vitamin D3, zinc, vitamin C, and then also substances such as quercetin and melatonin, which is a natural neurotransmitter in the human brain. All of those substances and a number of others which are in the source documents have been proven to strengthen people's immunity and to assist in preventing diseases like COVID. They don't only prevent COVID, they help to prevent many other diseases as well. There's a lot, and this evidence has been available for a long time, that immune boosting substances protect people from virus infections. Then, apart from the immune boosting substances, there are a number of what is called repurposed drugs. So those are drugs that have been available and have been well known to humanity for decades, of which billions and billions of doses have been prescribed with a large level of safety for other purposes. So there's, for example, ivermectin that has been used for parasitic infections with great success and safety. And there's hydroxychloroquine, which has been used for malaria in South Africa, chloroquine, with great success and safety. So those have also been proven through many studies to help to prevent people from contracting COVID. Now, why they help for COVID is not because they're anti-parasitic or anti-malarial. It is just happens to be, by good fortune, that the method that they work in the human cell is such that they block the processes that are necessary for COVID to enter the cell and to replicate. So it's just by good fortune that they work, but it is proven that they do work.
But SAHPRA's own investigation finds that there is no evidence to support that.
I don't believe that SAHPRA did any investigation. SAHPRA read some reports, and SAHPRA's answer repeatedly has been there's insufficient evidence to prove. Now, I cannot accept that there's insufficient evidence to prove that they help, because I can read the studies myself. Many other independent scientists and doctors can read the studies themselves and see the studies prove very good results. So why SAHPRA calls that insufficient evidence, I cannot explain, but it's not scientific and it's not rational.
Mm-hmm. And speaking about that, in your letter, you also speak about the double standards. For instance, with SAHPRA, when it comes to, let's say, ivermectin, but then on the other phase of it, you still have the clinical trials that are being run on the vaccines themselves, or the trials that are being run on vaccines.
Well, so just listen to these words, because this will make it more clear to your viewers. The one standard is, according to SAHPRA, ivermectin should not be used for prevention of treatment of COVID-19 because the available evidence does not meet the required standard of peer-reviewed prospective randomized double-blind controlled trials. I accept that. The trials don't meet that standard. But the contrasting standard of SAPRA is that people are urged to take the experimental coronavirus mRNA vaccinoids, despite the fact that the available evidence does not meet the required standard of peer-reviewed prospective randomized double-blind controlled trials. And despite the fact that the short-term trials that have been relied upon for SAPRA's EUA, which have been conducted by the manufacturing companies, have not been independently reviewed or reproduced. So they have provided their EUA for vaccines on trials of the manufacturers which are not independent and which can in no way satisfy the normal requirements for proving safety or efficacy. So the standard that they use for approving the vaccines is a completely different standard than the one they use for disapproving ivermectin. And we believe that they should use a uniform standard.
Mm-hmm. Does your point at all become moot now that the FDA has approved the Pfizer vaccine?
Not at all. I think the FDA has been grossly irresponsible in approving the Pfizer vaccine because of the fact that according to all the rules that have existed around the world, before any medication or drug can be approved for use in human beings, it has to pass phase 1, phase 2, and phase 3 human trials. Now, we know that those phase 3 trials will only be completed in 2023. So the FDA has thrown its own rule book out and for no apparent reason and without any explanation has approved a substance which has not yet completed the trials.
Mm-hmm.
So the FDA's approval appears to have been more a political or a convenient or an administrative decision rather than a responsible scientific decision.
Okay, let's just quickly take some of your calls. 011-714-2006, 011-714-2006. You can drop me a tweet as well at Alderin St-Pierre and drop me a voice note on 0614-104-107 just after this. Okay, we've got Gabriel is joining us on the line from Cape Town. Gabriel, good afternoon. Welcome to the show. Please be short, sharp, and straight to the point.
Yes, hi, Adrian. I wanted to comment about the professor here talking about the qPCR and not being specific. I just want to know, is he aware of which primers are being used and to what extent the cross-reactivity with other viruses that exist? Because we know that the genetic material of all the COVID viruses is publicly available. So, and then he should actually then come to say, these are the primers that are used to do the qPCR, to do the PCR, and then these primers have got certain levels of complementarity with other viruses. So I just want the professor to clarify that, because I would actually find it very worrying and frustrating that professors can come and use big words that in some cases actually may be misleading to people who may not understand this subject.
Okay.
Because my understanding is the primers are working because the primers have been found to be specific to COVID-19 genetic material.
Okay, Dr. Edeling, your response to that?
First of all, I just need to disavow you. I'm not a professor. I'm a doctor. So the question that is posed to me, the specific question, I can't answer because the information that would allow any doctor to answer that question is kept secret. But we know that the CDC has proclaimed, and more recently, the WHO has also proclaimed that because these tests have false positives and they're not specific, they are being discontinued. So how can this government rely on statistics by a test that has proven to be unreliable and is therefore being discontinued? But the particularities of why it's discontinued, I wish that they would provide that information. They haven't.
Okay, Thabo, quickly, Joburg, good afternoon. Hi, Thabo.
Yes, thanks for taking my call.
Mm-hmm.
Look, I'm really worried about what the doctor is saying. I'm a demographer, and I know that when you look at a disease like COVID, you also look at other things like rate of hospitalization and the number of deaths.
Mm-hmm.
And those correlate with the number of tests and the number of people that are infected. So even if the PCR is not accurate, it can be by a lot. It's not a matter of now accusing the government for hiding information. I think it's not correct. And again, he must take up this with the WHO, because it is not the president of South Africa who approved the use of some of this. It's emergency recommendations by the WHO. So I'm really worried about what
who approved it, Thabo?
No,
The final decision
the
final decision to allow it to be in use, for instance, in South Africa. Who makes that final decision?
No, I agree. Obviously, it will be our medical authorities in the country. Yeah. But after the recommendation from the WHO. And the second thing that worries me is that if somebody were to say that about HIV/AIDS, about supplements, about vitamin B12 and so on, they will be called an HIV denialist.
Okay.
And he will be one of the people who are saying so. But he's using the same thing about COVID.
Okay. Dr. Edeling, your quick response to that.
I'm not talking about HIV. I'm talking about specific scientific publications that indicate the value of vitamin D3, zinc, vitamin C, etc., in the prevention and treatment of COVID-19. If you read my letter to the president, there's a letter referred to therein called the Good News document. And in that, you can read all of the references that are included in that. And that is my source of information.
Dr. Edeling, thank you so much for your time. Unfortunately, we've run out of time and we have to go to the news headlines. And again, thank you for agreeing to join us on the show. It was supposed to be a debate, but unfortunately, as I've indicated, Morgan Chetty, the president of the Independent Practitioners Association, has pulled out of the debate. And also, we are still going to try and see whether we can pursue any of those people who are opposing the views that come from Dr. Edeling to come and join us on the show. Let's go quickly to the news headlines.
Aldrin Sampear on Beyond the Headline.